Hello, everyone out there in SADS Live Nation. It is great to get to be with you. We're recording this on June 13th. It's going to be a special one. In fact, it's so special that I'll tell you about it right now. I get to interview our outgoing CEO and the new CEO of the SADS Foundation. As you know, the SADS Foundation is the Sudden Arrhythmia Death Syndrome Foundation. This is your foundation. This is the largest and only nonprofit advocacy organization devoted solely and wholly and fully to you, families with SADS condition, long QT syndrome, CPVT, Brugada syndrome, ARVC, we're your home. And this has been a home for SADS conditions since the SADS Foundation was founded almost 34 years ago. December 1991, the founder, the late Dr. G. Michael Vincent from Utah, started the SADS Foundation. And he was its CEO for, a long time, until 2002, when Alice Laura became the chief executive officer. Alice has led us at the SADS Foundation for 23 years. That's pretty incredible. And she has been an amazing leader for us. Now, I came to the SADS Foundation when Dr. Michael Vincent asked me to join the board in about 2002 when he elevated Alice to the CEO. And so then I became a board member. And in 2006, he handed over the baton for the presidency of the SADS to me, where I would serve as the second president of the SADS Foundation following Dr. Vincent. As some of you know, that just before COVID struck in spring of 2020, Dr. Vincent passed away in February of 2020. Well, now we're at a transition point, successful transition point, I might add, where after 23 years of being our CEO, we have found the successor to Alice and her time with us as CEO. And we have hired our third CEO effectively, Mr. Walker Fromm. And this is our chance to introduce the present, the future, and also take a little bit to stroll back through memory lane with Alice's past 23 years leading us so well and so faithfully. And so we couldn't do it live because schedules were busy for today, Friday, June 27th. So I bring you this interview with our newest CEO, Mr. Walker Fromm. Aaron, bring on our new CEO of the SADS Foundation for summer 2025 and forward, Mr. Walker Fromm. Walker, welcome to SADS Foundation and to SADS Live, and a chance to introduce you to SADS Live Nation. Thanks for joining me. I know your schedule's busy on the day that we're airing this, so we get to do it now.
Yeah, thank you for having me. I'm really excited to be here.
It's great to have you, and this is your debut to SADS Live Nation, so give them a sense, our SADS community, a bit about you, your background, and what ultimately led you to say yes to wanting to be our next CEO.
Yeah, perfect. So to start off with, I, like several of our SADS team members, currently live in Salt Lake City. But I grew up in South Florida, and that's where my family still lives. I'm a Florida boy at heart. I went to New England for undergraduate, did some more studies in the Pacific Northwest, and discovered in my studies that I was really drawn to nonprofit work. I specialized in studying international development, nonprofit management, thought I would be a professor, looking at other organizations, best practices, particularly the power of coalition building in the nonprofit space. And as I got deeper into the field, I studied on a Fulbright in Europe, looking at nonprofits. And as I came to learn how this work is done, I felt more and more compelled to jump in and do the work myself rather than studying other people doing it. So I took the plunge, and I've spent the last 15 years or so in the nonprofit space, most of the last decade specialized in helping families rebuild their lives after being forcibly displaced. So I led a refugee-based organization, working a lot internationally, helping people displaced by war and natural disaster, and felt myself really drawn to that work of helping families to find their footing after passing through a trauma. And that became really personal to me a couple of years ago when sadly I had a long-awaited baby daughter who suffered a cardiac incident, undiagnosed cardiac incident during her birth. And as a result of that, she passed away a few days after she was born. And of course, that knocked me off my feet. And I found myself needing to rebuild and find my footing and find community and find answers moving forward. And ultimately, that's what led me to take stock of how I want to invest my energies, where I want to devote my efforts for the balance of my career here, and brought me to the SADS Foundation, where I'm now so excited to join the team that we have in making sure that nobody goes through that kind of experience alone, and working to do everything we can for our SADS community members to stop those kind of tragedies from happening in the first place.
Well, from a profound passion or actually profound pain to a discovery of a new and deep passion for SADS community. And thanks for sharing that. And you're not starting your reign as CEO today. You've been with us now for a bit over a month, working behind the scenes, getting your footing, trying to absorb as much from 23 years of SADS leadership by Alice and create the succession and the legacy institutional memory, if you will. During this month of working with Alice and the rest of the SADS team, what has stood out to you so far?
It's a really good question. I'd say two main things stand out to me. First and foremost, the culture we have at SADS is incredible. I've been part, both on staff and in a consulting capacity. I've come in contact with many nonprofits, and ours really stands out for what a healthy, positive, committed group of people Alice has assembled. Almost everybody on our team has some kind of connection. Either they have one of our SADS conditions themselves, or they have a family member, or in their lives they have come in contact in other ways with the rare disease community. They have a connection, they're motivated, they're passionate. And there's no shortcut to building that kind of culture, to creating a healthy work environment. And I'm honored to inherit such a fantastic place to be and such a great team of people to work with. Mm-hmm. The second thing that I've really noticed, and that I'm learning more and more as I become familiar with the landscape and the priorities of what we do at the SADS Foundation, is the urgency. Yes, many people with SADS conditions can lead stable, full lives, but that's not true for everybody. We're still losing young people to something that could be detected, could be prevented, could be treated. And even those who are treated have unmet needs around quality of life. And something I continue to hear as I talk to more and more people in our space, in our community, is how lonely it can be living with a SADS condition. It's hard to find providers who understand the diagnosis, hard to meet other people who know what you're going through. Often there are more questions than answers about symptoms, about risk, about treatment. And so I feel a real sense of urgency for us to be raising awareness, publishing, or helping research to get published, helping to find solutions in partnership with drug developers and other industry partners that can improve quality of life. And so that urgency has really struck me and is something that I'm trying to use as motivation as I take leadership here.
I love that. And you mentioned priorities, and as you've learned and been brought up to speed with the current priorities that you've inherited, what are a couple of them that we're working on now that you're really, really excited about?
Yeah, no, that's a great question. Right now, after for a long time, there wasn't a lot of activity on the drug development side in our space, and right now there is. There are more and more frontline therapies that are, they're still early on, but they're coming down the pipeline. These things take time, but there's energy building, and for us, there's a real imperative to be proactive here. We need to be bringing patient perspectives into every stage of this process, pushing for more accessible genetic testing that can help to find solutions, both in terms of treatments and therapies, and also for individual families. Advocating for diagnostic codes. We're making some real progress in doing that, which should help with insurance coverage and other things. And trying to gather and organize the kind of data that can accelerate all of that. Those are really exciting pieces that are starting to come together and that I'm really excited to work on.
Yeah, I totally agree. And you won't be surprised by my agreement with that. Well, let's turn a little bit from your identity as our new CEO and what you're inheriting. And in short time, you'll be starting to lay down and put down your fingerprint as you steer our ship and make subtle changes or potentially more dramatic changes as you get a sense of acting on the urgency. And I love that comment about feeling urgent when it's an organization that is 3+ decades old. Sometimes the older you get, the slower you get, and adding that I love that. But how about let SADS get to know you? You mentioned something very profoundly painful with your daughter. But let's switch to a fun fact. Give us, the community, a fun fact about you that would surprise them. A talent, a hobby, or whatever you want that is, I bet you nobody would guess this about me.
Oh boy. Most of the funnest facts about me are actually tied to my kids. So I myself am a crossword enthusiast and very devoted to that, but that's kind of boring. Much more interesting is I have a 15-year-old son. And actually, the reason why I can't be here live today is because he is one of the top, for his age group, he's one of the top 10 rock climbers in the country. And he's actually, yeah. And so he's actually this weekend, the last weekend in June, climbing in Portland in USA Nationals, competing against the other top climbers in the country. So that's really fun, and I live vicariously through his achievements. I also have a 3-month-old son, and a fun fact with him is, so I actually speak exclusively with him in Romanian, and my wife speaks exclusively with him in Swedish, and we'll see how he turns out. We did that with my older son, and he understands Romanian that I speak. It's harder to get him to speak it. We're gonna see if we can succeed with this younger kid. So those are a couple of fun facts.
Those are awesome. And for your son, rock on.
Thank you.
Now this is Walker Fram. I'm so excited to partner with him and to see this next chapter come forward and be ushered in. But let's not forget how we got here, and to not forget, Aaron's going to bring on our now past CEO of 23 years, Alice Laura. Aaron, bring on Alice to join Walker and me. Alice, great to see you. Man, oh man, we have done a lot together in 23 years since you became Dr. Michael Vincent's successor. And let's stroll down memory lane just a bit and give your reflections and thoughts on those very early years. Yes, when you became the CEO, SADS was 11 years old-ish. But what you've done over these last 23 years has been nothing short of impressive and mission critical. Take us back to the early years and what you inherited and that initial time with Dr. Vincent. And
it was amazing to start, for sure, and a little daunting, as you know, and we definitely doesn't seem that long, for sure. But, learning from Dr. Vincent and realizing things that I still tell people, like when he was looking at this in the beginning and finding that first Christensen family, I mean, there were no ICDs. Right? There was most of the even basic therapy that we have now, or a lot of that, wasn't even developed. So what he put together were, guidelines for what happens, what should you do as a person, how can you tell if you're okay as a kid playing sports. So anyways, I still think most of those things with your guidance, we've really expanded and know that, a lot of those things were right. And now we know because we've got the research. But in the early days, just learning from what his experience with families, and also with Catherine and her going to all the family reunions and collecting all the blood samples and the EKGs of family members so they could look at building that big pedigree, which at one point before cholesterol, I think, was one of the largest pedigrees in the world, in the medical world. So it was pretty amazing. So I was, grateful to learn from them. And then, starting kind of our board was really tiny. I was the only staff person for a while. There was some part-time when I started, and they all were like having a baby or retiring or, leaving right away. So just trying to learn what to do. And now, different, right? It's totally different.
Very, very different. And you mentioned Catherine, as in Catherine Timothy,
Right.
one of SAD's early treasures and a nurse, and for which many of our SADS community will know of as Timothy syndrome, which was named by Mark Keating in honor of Catherine Timothy and all of her work. Those are two of the original, treasure pieces in the SADS Foundation.
Exactly. And Catherine used to come down and meet with me, sit with me, and go over more of the science that they knew at the time, and etc. So it was pretty. And then I used to have her come when we had new staff members, once we started growing a little bit, to talk about what's an ion channel and, how does this work, and all those things that she had learned working with Dr. Keating and finding those first lung QT mutations. She was really a part of that team in the back end.
So in a very small N of one team where you were everything, CEO, counselor, fundraiser, developer, everything. In what ways has SADS developed and grown over the past 20 years that under your leadership that you have really enjoyed seeing?
Well, I would say one thing before I start that part. I did have my dog with me, so I wasn't all alone.
That's right.
That's one thing, but that isn't scary. That's the hardest part, is being alone. And now we have a fabulous team, which is one of the first things that we really worked on and developed. And now, as Walker said, have an excellent, wonderful team, and that is night and day. More fun to come to work, get a lot more done. Really appreciate the various ways that people have of doing things and ideas they have. And so, obviously we have to have some budget for that. So that was another thing that we tried to work on, and it's been up and down. And but definitely grown since we were in the beginning, since you started, Mike, with us as well. We've grown the budget together. So I think that's huge. And along with that, of course, why do we do that? It's not just so we can come to work and meet with these great colleagues, but really the support and the services that we can provide to our SADS communities has grown exponentially. The SADS communities have also grown. And like Walker said, we understand all the needs they have and the needs they still have. But I think over the years, we have provided a lot in that regard with education and conferences and places where they can meet each other and learn that there are others in the world and they're not alone, and things are the same. And so I think that's huge. And I think the other two things really quickly is, one, really being able to partner with researchers and clinicians like you to make sure that our folks are getting the best care that they need and deserve, and to make sure that we can help other physicians that are seeing patients to know what you know as much as they can, and what's the best science, what should they be doing with to help people that they see. So I think that's a
Yeah.
huge thing. And then the other one is really partnering with organizations, and I did a lot of that, deliberately trying to meet other organizations that are similar to us, small groups with the heart, and the big ones like American Heart that really helps us
Yeah.
in provide services as a teeny organization, with coming together, doing
Right.
stuff. So I think
Well,
those
Alice, I'm going to give you a super hard question.
are,
And this is the Scott Van Pelt ESPN One Big Thing, because
oh,
I know working alongside you for 23 years, there are lots of things that we are proud of with your career at SADS and leading us. So it might be hard, but I'm going to ask you, what's one that you will look back and say, I am super proud of this accomplishment from my time as SADS as CEO?
yeah, and that's really hard. Even getting the question ahead of time, it is really hard still. But I do think that one big thing is looking at the patient voice, like Walker talked about, and elevating that especially in research, but in everything that, what do they experience? What do they have to tell us? And how can we make sure that they are heard in the medical world, in the research world? I think that's huge. And I think when I started, that wasn't as much. Of course, care wasn't that way in general, but to really say we have that now, and I think
Yeah.
that we only can grow that. I think that's huge.
And you have handed off the baton and watching behind the scenes with your role in wanting to ensure a successful handoff to the next CEO, which, as you all know, that is not easy in the nonprofit world, especially when the prior CEO, it was either the founder or was such a long-standing CEO of 20 plus years. And yet, as you and I know, we've been discussing this for 2 years. What's the succession plan? How do we ensure that the best days for the SADS Foundation are still in front of us?
Yes.
And you help the committee find Walker, pick Walker, mentor Walker, and provide all the institutional and organizational memory, or a lot of it, as he can absorb like the sponge. And you're not disappearing tomorrow.
Right.
Your role in mentoring Walker continues. But as you think about this handoff and the future that's in front of our organization and in the future for the SADS families, what excites you the most about that future?
So number one, what you just said is absolutely what my goal was in starting. We didn't have any of the basics of a nonprofit organization when I started, but I really said, we need to have that developed enough so that when I leave, then they're not saying, what do we do now? They're saying, we hire a new CEO. We hire these staff members that are key when they move on or whatever, that we have an organization that is real and stands by itself. So I think that is number one. It's not going away, and we're here for the long term. So that is huge. And then the other really interesting thing that I've said to Walker already, and I say in other ways when I was pretty new, not like day one, but pretty new, going through stuff and talking, I wrote down a couple of things that I thought would make life really a real difference in the lives of people with SADS conditions. And you know what? We have done a lot and they're not solved. So that's what I'm excited about. They're getting to be closer. Like, can we get better, more accurate, faster diagnoses of SADS conditions, especially when you're not seeing an expert? You know, can we make that pathway shorter and easier? What is my personalized risk if I get a long QT syndrome, or, you know, what do I need to know? I think that is huge, and we're getting closer. And then the last thing that I said wanted, and I have the document, I pulled it up today just to check, but, you know, obviously we want a cure and better treatments along the way. But, you know, again, like Walker said, we're getting way closer. But anyways, I think we're getting way closer to that, all of those things, because of the expert scientists and clinicians that have been working in the field. So
Yeah,
thank
well,
you.
on behalf of thousands of families, literally thousands, that have looked to the SADS Foundation for guidance, for encouragement, for hope, for direction. I thank you, Alice, and all of the SADS Live community. Just are so grateful that you said yes to Dr. Vincent 23 years ago, that you took this role and you took it where you were the N of one operation of a small mom and pop's organization. As my mother would say, champagne taste, but on a beer budget, where we had nothing. And you brought us, and we have matured into an organization that is alive and well, a board that is very committed and passionate, members of the SADS team, whether it's development, whether it's education, whether it's support, where they know their roles, and their commitment to the SADS families is unmatched. And now to the handoff to Walker. And so thank you for that. Can't wait to see what role we have you with us in this transition phase of ongoing mentorship and special project assignment, because your gift set is so rich that you don't get to just disappear on us. But as we now turn over the official reins to Walker and his leadership for us, I, on behalf of the board, we're just supercharged. I'm confident that, like you said, we might be 34 years old now, but our best years are in front of us. And we are dedicated to you all out there at SADS Live, that there's going to be more hope. There's going to be more encouragement. There's going to be more therapies that are therapies for you and your condition. We will get to the point where there will be an actual therapy where the FDA approved indication says your diagnosis. I share in that urgency, and I will partner, and the board will partner with Walker with that sense of urgency. So, and I can't wait, Walker, for you to join me on future programs, live and in real time. And we'll bring you back, Alice, again for a live and real time
Sure.
reflection to get your thoughts a year from now, 3 years from now, on how are we doing, and are we running the race well. So thanks for joining me, and I hope when this airs and when we learn, Walker, I'm going to think positively that your 15-year-old will have won, because I like winning. So all the best to the two of you. Thanks for joining me. And now, Aaron, we will continue on with a short 15-minute segment of